Welcome, everyone. Thank you so much for joining us at our Parent Up program again on a surprisingly snowy, sleety, I don't know what's happening out there, evening, but we really appreciate you being here. I think most of you, or a lot of you, have been on our Parent Up programs before, but just in case, we started this because parenting is really hard. And we have access to a lot of expertise around the Pittsburgh region that we wanted to bring to everyone who might be struggling with a tough parenting issue and need a little extra support, or just to know that they're not alone, that other people have experienced this, and there are resources out there that we can point you to make the job just a little bit easier. And that was really how Parent Up Pittsburgh was born. So we are in our second year of doing this, and we really try and pick topics that are issues that are prevalent to parents and or are particularly challenging, and we bring regional experts in to help you. So we couldn't do this without NAMI, who is our primary sponsor of Parent Up Pittsburgh. So we want to say a big thank you to NAMI for coming back to the table again this year and sponsoring Parent Up. If you want to see anything that we talk about again, if you missed something, if you want to share this with someone who you think could benefit from it, please keep in mind that all our Parent Up sessions do get uploaded to our YouTube channel, and they're available for viewing. We have all of last year's on there as well, so they're available for viewing at any time. And I know we have gotten a lot of folks who maybe can't join us on a Monday evening, but have gone back and watched those, so they are available to you. So with that, our topic this evening is talking to young people about preventing suicide. And I'm really excited to bring back another guest who was here last year with us. Dr. Anna Radovic is an assistant professor of pediatrics at the University of Pittsburgh. She is a pediatrician and subspecialist in adolescent medicine. Dr. Radovic completed her undergraduate and medical school at Case Western Reserve in Cleveland. She completed her pediatrics residency in adolescent medicine fellowship at the University of Pittsburgh Medical Center, and also received a master's in clinical science at the University of Pittsburgh. Her focus is on how to use technology to improve mental health services for adolescents with symptoms of depression or anxiety. And she studied primary care provider attitudes towards approaching shared decision-making with parents, the use of electronic order sets, and screening decision aids to improve the integration of behavioral health services in primary care settings. And she's also looked at the impacts of social media and technology use in depressed adolescents and their parents. So Anna, thank you so much for joining us again. We're so excited to have you. With that, I will go ahead and turn it over to you.
Okay, thanks so much for having me. I appreciate it, Laura. I'm gonna just share, let's see, the PowerPoint. And then I'm gonna make it big. Okay. And everybody sees it okay?
Yeah.
Okay, great. And feel free to put like maybe some questions in the chat, and then when I'm done, you can see if there's any I haven't answered. So I'm trying to translate a difficult topic for you all, so I really appreciate any feedback because in terms of like, are some things too basic or are some things too difficult to understand, and kind of what's missing. But I'm trying to translate in this talk some of the things that we talk about as clinicians about suicide prevention, because more and more of us are thinking about how everyone needs this information, not just us in clinical settings. So I think Lori introduced about me. I work in our UPMC Children's Hospital in Oakland. We have an office for adolescent and young adult medicine. So Maine Children's in Lawrenceville, but our office is here in UPMC University Center. And we see adolescents for primary care, but also we see them for problems that happen more frequently in that age group. And we see up to age 26. So if you need any support, feel free to check us out. And the only thing not mentioned is I'm also a parent to a 7 and 10-year-old. So I received some funding from National Institute of Health. So mental health and minority health and health disparities is my only disclosure. So today was hoping to increase your knowledge about some factors influencing suicide in adolescents and gain confidence in how to talk to them about it. So this recognizes that talking about suicide is difficult. So it is an upsetting topic, especially if you know someone who's died from suicide. One thing to keep in mind is that for some people, suicide can be, a uncurable problem. And so the thing that helps me, because there's a lot of blame and shame around suicide, is I went to a presentation about a really, really, really super expert giving the best high quality care, and still some patients died. And so, we want to prevent suicide, knowing that for some people, unfortunately, it can be it can be not prevented. Just like every disease, some are curable, some are not, but we can always try to do better. That being said, there's a lot we can do that we are not doing as a society. And because this is a difficult topic for all of us, you should know that there's help if you need it, and that now 988 is an easier number to call as the suicide lifeline that you can also text and chat. So if you call it here in Allegheny County, you'll connect to Resolve Crisis. So you'll connect with the local crisis services. Okay, another important thing to know is that talking about suicide does not lead to suicide. And so sometimes it might feel like, oh, well, I don't want to bring it up because maybe someone then will kind of start thinking about it more. And the research shows us that this is not actually true. And so not talking about it might be something that, limits being able to prevent it. So although it's uncomfortable and upsetting, it's okay to talk about suicide. So unfortunately, suicide rates for teenagers, so high school age in the US, were actually going up even before the pandemic. So this is looking just at the binary of people identifying as male and female, that those rates were going up to 2015. So this is deaths per 100,000 in the population. But just to take a deep breath, I put this pause here because recently the data came from high school students surveyed in the Youth Risk Behavior Survey, and they're just pretty upsetting numbers. So this is for looking from 2011 to 2021. So again, this is just a binary of female identifying, male identifying, so it's limited by that. But there's been an increase in the percent of high school students who say that they seriously considered attempting suicide in the past year, from 19% of those identifying as female to 30%. So almost a third seriously considering, whereas in males, it didn't change very much. Then looking across race and ethnicity, those seriously considering suicide, always, it seems like in these statistics, the people that are most marginalized are having the worst rate. So multiracial, about a quarter of them have considered seriously attempting suicide, and that hasn't changed, only up about 2%. But then it's increased in other races and ethnic groups. So in Black youth, it's increased. In Hispanic youth, it's increased. In white youth, it's increased. Then when you look at those who've attempted suicide, about 13% of those identifying as female have attempted suicide in the past year. That's a huge number, even, 10% in 2011 is unacceptable. I don't think many people were thinking about how high the rates are until this pandemic, but they were high a decade ago as well, but they've been increasing. And same for those who've attempted suicide in terms of race and ethnicity. But you can see this orange dashed line. There's been a big increase in Black youth, 8% in 2011 to 14% in 2021. When you look at all of the high school students in 2021, 10% attempted suicide, 1 in 10. It's just huge. It's a huge, huge number. 16% in those who are American Indian or Alaska Native, and 22% in those who identify as LGBTQ. I don't see T there, but I think they were probably included in that group. So that it's just like astounding to me and to a lot of folks, but especially in the pediatric community, our Children's Hospital Association and different pediatric serving groups got together to really sound this alarm and say, America, this is a wake-up call, because what we really need are heavy, heavy, heavy policy changes. There needs to be mental health services more readily available in schools. There needs to be greater reimbursement from insurers for mental health services and to actually enact parity laws. There's a lot that needs to happen, advocacy-wise. But for right now, what kind of can you do on your end as a parent? So some things to think about are, what are things that help and what are things that hurt? So there is this model looking at the society level. So what's going on in our society? One issue is having access to lethal means of suicide. So people who are having suicidal thoughts, typically it's a wave that passes. Some people have thoughts all the time, but most people, they increase and then they go away. And when those thoughts increase, they have a risk of acting impulsively. If they have access to something that they could die from easily, like a gun, versus something like pills that take time to work and they might have time to tell someone and go to the hospital, that is definitely a risk factor. And then whether they have available physical and mental health care can be protective. Seeing things on the media that are portrayals of suicide or talking positively about suicide or not giving access to resources can be a risk. At the community level, having safe and supportive school and community environment. And then after psychiatric hospitalization, having access to care. And risk factors or barriers to healthcare. And then relationship is really, really a big one for preventing suicide. So feeling connected to others is really important. There are some theories in why people have suicidal thoughts that come from this thwarted belongingness, meaning like, I don't belong in any group with any group of people. I don't feel connected to others. So having that is important. Unfortunately, having family history of suicide or really high conflict or violent relationships can be risk factors. And then on the individual level, we're going to talk about these more, but it can be protective if people have other ways to deal with emotional distress. So that is called distress tolerance, okay? And we're going to talk a little more about that, but having ways to deal with that distress instead of suicidality can be helpful. Increasing reasons for living. So having responsibilities, feeling like you're connected to others, maybe like caretaking of younger kids or being part of a group, or having also moral objections, so religiosity, those can be protective. And then individual factors, the main ones are having previously a mental illness, having problems with substance use, so having your kind of guard lowered so that you might act more impulsively. Having a prior attempt is the most strong risk factor for a future attempt, and being someone who has impulsivity. So going through this list of risk factors, we talked about some of these already. Sometimes, though, it might be hard to predict someone is going to have suicidality. Sometimes it can be more that they're irritable and agitated, aggressive. One thing prior to having more suicidal thoughts, many young people have had really poor sleep, insomnia. They feel like they're a burden to other people, or they're exposed to potential suicide contagion. Many people who aren't familiar with suicide might feel like, oh, well, maybe this person was selfish and they just like wanted to end their pain. Often people are thinking unselfishly, like, I feel like I'm causing so much stress and problems for everyone around me. They would be better off without me being here. And so that perceived burden is a big one. But you can see how things that make you feel like you don't belong, plus you're impulsive and you're kind of stopping yourself from doing something impulsive is lowered because you're not sleeping, or you're abusing alcohol or drugs, or you're really irritable, agitated. Those kind of things can contribute. And then having sometimes an acute event, which leads to this like deep humiliation, so that you feel like so hopeless, as if this horrible thing happened, like I was humiliated in front of all of my friends, and there's no going back to living a regular life after that. And then again, reaffirming this like protective factor. So feeling connected, like I belong somewhere. Even if, let's say, something horrible happens in my friend group or on social media or wherever, I still belong to this core group of people in my family. And, so that kind of keeps me centered. Feeling like you have some control, feeling like you belong in your school and community, and having some skills, having a strong therapeutic relationship with a provider, also spirituality and being regularly at school. So what are some early warning signs? So you don't want to, and some people will say, oh, this person is threatening to kill themselves for attention. You don't know whether that's true or not. It may or may not be true, which is why every kind of threat should be taken seriously. And also, if their threat is a cry for attention, it's a red flag that there's something else going on. There's another problem, even if it's not suicidality. So this person needs help. If they're looking for ways to end their life, like stockpiling medications, if they feel completely like there is no hope or no purpose, if they give away things that are important to them, they're irritable, the sleep problems, like I mentioned, increased alcohol or drug use. Sometimes parents ask, like, well, isn't it normal for teens to be irritable or not want to talk to me? And it's like, yes, you don't want to necessarily spend all of your time with your parents. But if you're also withdrawing from your friends and everything else that seemed to give you joy, that's not typical. That's not something that should be happening for a teen. They should be really thriving on spending time with friends. Having rage, uncontrolled anger, seeking revenge, high risk activities, having dramatic mood changes, feeling like there's no way out. And so again, just kind of going over these, this is another helpful handout. So knowing warning signs, which I've mentioned, talking about these things, especially like the little sleep, the agitation, showing rage, seeking revenge, feeling hopeless, more drug and alcohol use, looking things up for a way to kill themselves. And these are really uncomfortable, difficult, awkward questions. Like they feel very uncomfortable to ask. That being said, it's okay to ask them. And some things we do as providers, or I'll do, is I'll say, you know, have you been having any thoughts about ending your life? Unfortunately, you know, many teens have thought about this before, many people your age. And so I just wanted to make sure you're okay. And then if they're like, no, 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 like I haven't, etc., then I'll say, well, just so you know, like you can always talk to me about this. Or if you don't want to talk to me, if I were there, not their provider, so if you don't want to talk to me, we can always go somewhere to someone you can talk to. Or if one of your friends is ever thinking about that, they should talk to their provider. If you feel like suspicious, but your teen is not telling you, take them to see their provider. So basically, there's confidentiality laws that protect the teen when they're talking to their healthcare provider. That way, if they're saying something like, oh, my friend is graffitiing up the neighborhood or something, but they don't want their parent to know, because then they won't let you hang out with your friend. That's not something a provider has to share. And sometimes like teens might be worried about different things, but one of the limits of confidentiality is when they're at risk of harming themselves. So if they're at risk for suicide and they share that with their provider, that's something, if it's safe, if the parent is a safe person, that we get the parent involved. And so you should feel comfortable taking your child to the provider, saying, I just wanted them to come in for a mental health check-in. I'm not sure anything is going on, but they've just been more irritable. And I was just hoping you can talk with them confidentially, just to check in. And that would be completely reasonable. So do's are let the person talk and listen to them without judgment. This can be really hard when you are related to someone, or you are worried about them, or your emotions are kind of driven by how they might act. So you really want to try to like take a deep breath and kind of get ready for it. And then reassure them that treatment and help is available. Tell them what they're experiencing is treatable and suicidal feelings are temporary. So that for most people, they are temporary. And you don't want to try to minimize their problems or shame them or convince them, oh, it's not really that bad. You shouldn't be thinking this way, or suicide is something that's wrong. That's not helpful. And then if someone does share that they're suicidal, you should stay with them and get them help. And keep the conversation going until you can get them help. This is a little bit older, so it's from save.org, or Suicide Awareness Voices of Education. So it doesn't have the 988 lifeline, but it has other information like the crisis text line. Okay, so if someone tells you that they've had suicidal thoughts, you actually want to thank them for trusting you with something so personal, because it can be really scary and vulnerable to tell someone about something like that. And so the first thing you say might not come to you to say thank you for trusting me, but that can really help with that kind of connection with them, that they don't feel shame afterwards if you kind of accidentally say something like, oh my God, I can't believe it, or something like that. So these are just for you to see some of the mental health risk factors that we think about addressing in terms of what could be risk factors for suicide. So most people think about depression, but not everyone thinks about anxiety as being a risk factor, as well as impulsivity. And then we'd mentioned hopelessness. Anhedonia is like that you don't have pleasure in anything anymore. Nothing brings you joy. things you used to do before, like art, etc. No, nothing makes you feel anything anymore. If you feel isolated, irritable, we talked about substance alcohol use, we talked about sleep a lot, appetite changes. And then social support is really huge. So having, even if, let's say you have a conflict with the child, but if they have a different supportive adult or other supportive people, still as you're working through your conflict, letting them have contact with those people, to kind of continue to have some social support. And then how they're doing in school, being bullied. Suicide contagion is knowing others who've tried to kill themselves can sometimes make someone else feel like they should do that too, and whether or not they have reasons for living. Okay, so the main kind of treatment to do to prevent suicide is to see, what's the underlying risk factors and how can we change some of those things. But those things can take time. And so while you're kind of addressing those things, one thing that we do is plan for safety. And what that means is that we know that suicidal thoughts can come in waves. So probably many of you experienced road rage, and you know that it's kind of a fleeting thing. Let's say you're driving somewhere 2 hours away, you're probably not having road rage the entire time. And usually what happens is that you have some kind of like event that happens with someone else driving, and maybe you feel strong emotion like fear or anger, and then you might impulsively feel like, well, I should start tailing this person, or I'm not going to let them get away with this, etc. And what might happen is that you get in an accident, or that person is aggressive toward you, and that's not a consequence that you would want, but in the moment you feel like it's the right thing to do, you feel really strongly about it because your emotions are so high. So you can't really access the thinking part of your brain. And if you had a plan, if you knew that that's something that happens to you, and your plan was, you know what, when that happens, I just take the next exit and I stop by like the gas station and I go in and get a snack, and then by that time the feeling goes away, because it's like a wave that you'll ride. Well, it's the same kind of thing for most people with their suicidality, that it's kind of this like emotional wave where you're so distressed, you're at the top of your distress, that you can't really access that thinking part of your brain. So you basically have to have a plan. What do you do until that distress passes? And more studies are finding that teens who have a lot of trouble tolerating distress are having problems with suicidality. So that's one thing we can do, is pattern to young people, hey, I'm really mad at this person for cutting me off and I need to cool down. I'm going to pull off the side of the road. Like, I'm going to take a breather. It can really help to see adults role modeling, how do I deal with this distress? And so the first way is to know, what are the warning signs? So if they've felt suicidal before, why is that? What were some of the things that really set them off? And so sometimes it has to deal with a parent. Like, it can be really difficult to talk to your parent because your parent is in control and they're worried about you. You don't want to make them upset. There's so many different emotions involved there. And so sometimes you just can't deal with all these emotions and you need a break. And so sometimes parents and their kids can come up with maybe like a code word to take a break. And that's like a healthy way of patterning for them. Okay, here's how to have a healthy relationship. Like, we don't want to say things that hurt each other. And if we get too emotional and we need a breather, we need to let ourselves take a breather. Now, if there's like a discipline issue and you don't want them to just abuse that privilege by getting away with things and not having to talk about it anymore, you can have a set time, like, okay, we're not going to talk about this. You're going to get a break, and then we're going to talk about it again tomorrow, or in another format, like you'll write me something about what's your argument and I'll write back to you, or something like that. The second thing is, let's say that doesn't work. You can't avoid the situation and it happens. The first step is, what are things you can do on your own without talking to anybody else to get your distress down? Now, some coping strategies, which are like, journaling, thought restructuring, really kind of things of thinking through it, are not accessible to you when you're in that high emotion, like road rage kind of state. And there's different skills that are actually available to learn online, but also therapists that provide some of these skills, and they come from dialectical behavior therapy around distress tolerance. So there's really neat things that you can do. One of them is like the tip skills, which are um, putting your face into cold water. So that basically gets your heart rate down, doing really intense exercise, doing paced breathing, progressive muscle relaxation, other things you can see kind of here, that are different things that someone might do. And they even might build like a little crisis toolkit. So they might have a little shoebox under their bed that has different things in there, like Play-Doh, stress balls, bubble wrap, um, you know, puzzles, sensory bottles, different things that they have where they can just go to it and use it, whatever works for them. Another one is like opposite emotion. So you can't really uh, cry and be upset and laugh at the same time. So having something very funny, that always makes you laugh, and being able to go to that. Okay, let's say those things don't work. Step 3 is people in social settings that provide distraction. So maybe it is that you walk around the neighborhood and there's always a older woman walking her dog, and you strike up conversation with her. Or maybe there's like a younger sibling who always wants to play with you as a teen, and you never want to, but this time you tell them like, okay, I'll play whatever video game with you, and they're very excited. It doesn't have to be someone the teen is telling how they're feeling, but someone who is doing something else with them that gets their mind off the distress. And then next is, who are people I can ask for help? So these are people that they can talk to about how they're actually feeling in their life. And, sometimes it can be tough for the parent, and we'll talk about that a little bit later. So it is okay to have other supportive adults in who you trust, that they can go and talk to, who it's a bit easier to kind of tell some of those things to without feeling guilty or bad. And then step 5 are who are professionals or agencies I can contact. And then step 6 is having access to the crisis lifelines. So crisis support or 988. And so one really important thing to remember is this impulsivity and not having access to lethal means. So unfortunately, gun violence, especially with homicide, but also suicide, has become a top killer of children. So this is a website, Project Child Safe, that has different availability if someone doesn't want to remove a firearm, for how to store it safely. And so then kind of what you would develop is this patient safety plan, where you kind of have all of these things listed, and it can be good to have these like written down if there's something a provider works with the teen with, and then having it like easily available. One thing is, I'm also involved in research, like Lori said, and we have a study where we're evaluating a safety planning app that has a way to kind of guide a young person to put in their plan, and then get them access to some of these distress tolerance tools. And at the end, I'll give you information about how to look into some of our studies. So one thing I want to share with you are actually interviews we did with parents at our adolescent medicine clinic and their child. And we wanted to learn, how do they communicate about mental health? So the average age for the teens was about 16, and we had 65% identified as female, 30% is male, and 15% is transgender. And then about 5% were a racial or ethnic minority. They had kind of more moderate symptoms of depression, that's the PHQ-9, and almost moderate symptoms of anxiety. And then most of them did the interview with a mother figure. One person had a father. And some things they talked to us about were just really interesting of why they don't want to talk to each other. So teens said that they were scared of burdening their parent. This teen said, at first it was very hard. I didn't want to admit to my mom I was having these feelings of anxiety and sadness because I didn't want her to feel like she was doing something as a parent that was making it happen to me when it wasn't her. So it was just like so, I don't know, sweet and sad at the same time that I feel like as a parent, usually I'm thinking like about my kid, be like, oh, well, he doesn't want to, or she doesn't want to tell me something because like he doesn't want my response or doesn't want my thoughts or something like that. Like it's something about me. It was really the teen like worrying about that parent being upset. Um, and burdening them. But then at the same time, parents felt guilty about talking to their child. At first, I would say I felt to blame. So I felt really guilty because, like, it was my genes that, led to her to feeling the way she does. And nobody wants to see their child suffer. So I was guilty and I was angry at myself for having, putting her through this. So it is kind of, and these are different. These were not the same teen and parent, but we heard this over and over again, like the parents feeling guilty about their child suffering and the child feeling like they don't want to burden their parent, and just somehow helpful it might have been to kind of open up about those things. And then one teen said that their parents were kind of dismissive. First, for me, my parents almost didn't believe that anxiety depression was a thing, and that made me feel like I was doing it for attention or stuff, and that was certainly not the case. And that makes me feel bad about having these problems, and it makes me feel ashamed. And so sometimes parents can react this way because they're scared, right? So like you'd rather be in denial than know that this is something your child is going through. Or it might just be lack of kind of education on the topic. And parents said sometimes their teen wasn't open. I feel like maybe he only wants to show me his best. He doesn't want to show me his worst. And it is what it is. And so teens can be worried about what their parents see. So some things that were promising were that they also shared things that helped them communicate. So one thing was actually disclosure of family history. So teen said, I realized she was going through a lot of the same things that I was as well with mental health. So when we started sharing how each other felt and what we get, like when stuff happens, it really helped us to get a common ground, understand each other more. And I think even for youth who aren't biologically related to the parent, it can be helpful because you have this assumption that adults have it all figured out and it's just me, trying to grow up, but I can't grow up and I can't figure out growing up. So it can help to see that like adults struggle too. And then parents shared about open-mindedness. That would be the advice I would give parents. Acceptance. Let it go. Who cares what your neighbors think of your kids getting mental health treatment? Like I said, you either get them the treatment or you come home to a situation. So at the end of the day, it's your family and your life, and other people will think what they'll think. But that's really their issue. Having patience during conversations was also thought to be really important. Well, you can't force someone to talk. So if parents try to force someone to talk about stuff, it'll just lead to maybe something being made up or not the whole story coming out because the teenager or child isn't ready. So this is like the most difficult thing because parents are busy. And then, you ask them one time, you ask them again, you ask them again, and then they still might not tell you. And that can be really tough. Having that patience is very, very hard to do, but this adolescent was talking about that was something they wanted. Honest communication, the adolescent, if my child, wouldn't have told us 6 years ago that he was feeling suicidal, I don't even know today if we would be even realizing the struggles, the mental health struggles that he was having, but he was honest enough to know that he was feeling like that and that it was important to tell us that. So having that honest, trusting relationship is really like a precursor to being able to be open about these things. And then one thing is that, let's say you can't do it on your own. A lot of folks shared about how therapy helps. So a teen said, I think having a therapist really helps because it's a professional. So if it's coming from the kid to the therapist and the therapist repeating it back, I feel like that really helps parents to really understand there's another person telling me there's something going on. And then the parent said that the therapists were able to help us find better ways to communicate with each other because sometimes I might say something that might be offensive to her, but I'm not realizing it's offensive to her. And they taught me different ways to talk to her. So sometimes, teens are trying to transmit information, parents are trying to transmit information, but the way they're transmitting it, the style, the kind of approach is not getting that information across, and it can lead to these stalemates. So therapists can kind of see both sides and help teens and parents talk to each other. Open communication with a therapist. So the therapist and outside source, so you don't have to filter anything. You can just be honest. It's definitely nice to know that they're not related to you in any way. So a teen can talk to a therapist without kind of holding back because of those feelings of guilt. Um, and the therapist can be kind of a in-between person that the parent can rely on to keep them up to date about, if things are getting worse. And then one parent remarked, sometimes I think that when she tells the therapist what's been going on, the therapist might ask, why do you think your mom said this? Or why do you think this happened between you two? I think that going to the therapist has allowed her to take a step back and look at me differently. So it helped also the teen kind of understand their parent. So lastly, I just wanted to share some resources with you, but oops, this didn't kind of come out well. This is supposed to say research. But if you're interested in research, so that was one of our research studies where we came up with that kind of information about how parents and teens communicate, which I thought was really exciting and could be helpful to others. Right now, we're recruiting for different studies, and you can access all the studies we're recruiting for if you go to redcap.link/Kaya research. Sorry, that H didn't carry over for a few different studies. But other places you can go. So American Foundation for Suicide Prevention has some really awesome resources. This is a website about kind of what parents should know, how you can educate yourself. We have a Society for Adolescent Health and Medicine at adolescenthealth.org that has different resources for parents. This is a really awesome website called fosteringresilience.com, and it is by a physician, Ken Ginsberg, who's really put together what are positive ways to grow positive strengths and resilience in young people, and growing these kinds of things and having teens be more connected and feel like reasons for living can be really a great way to support them. And then there are different trainings for getting more education about suicide prevention as even a layperson. So there is this question for persuade, forget the R, refer training that is available online. There's also mental health first aid that is available that some of you may have heard of, and there's also a youth mental health first aid. So these are psychoeducational approaches to sharing information about mental health disorders and how to help in crisis. And then this is a website that is putting together different resources that are available online. So apps, but then also judging them based on whether or not they show evidence and whether or not they are kind of sensitive to confidentiality. So it's put together by a clinical psychologist and his team to help kind of provide some more rating for the digital tools that are available. This is a website intervention that I've hosted for the past 7 years, where we have young people contributed to a positive social media community where they write their own articles and comment based on what they've written to kind of provide some support and connection to those having difficulties with depression, anxiety. And if you know young people who like to write and share their experiences with others, they can definitely go to our website to participate. And then this is a website we have for parents. So just note, we haven't updated in a year, but we're planning to. But there are a lot of resources there and a lot more information about mental health that you can still access if you go to that mental health topics link. So that's ysova.pitt.edu. And I think I finished in time. I was just worried. This is my email, so feel free to reach out, and our research website. And then that's the link for research. Okay, so let's see.
Anna, before we open to questions, will you send me the PowerPoint so I can send it out to the participants today?
Yeah.
Is that okay?
Yes. Trying to
Wonderful.
remember if I made any mistakes.
And you can send it to me tomorrow or whenever, just in the next couple of days.
Yep.
Thanks so much.
Oh, my contact info slide. I'll put it in the chat.
Oh, perfect. I'm just checking
Oh.
to see.
Weird. Huh. I shared a picture and I put that to everybody. Yeah.
It looks great.
Yeah.
Yeah, perfect. We do have a few minutes. If anyone has any questions, you can certainly you can put those in the chat. I had two questions that came to mind, unrelated. The first one is around, we talked a lot about teens and youth and the risk for suicide, and that 15 and up kind of range. Do you know, has there been a corresponding increase in younger kids? Is there an age or sort of a developmental stage that parents should be keeping an eye out for? I'm thinking about, some of the situations that pop up in the news. I know locally a few years ago, it was a very young kiddo still in elementary school who committed suicide or died by suicide, in part because of some bullying that was happening, and again, that isolation. So is there, is there a point that we should be more aware than others in terms of what a child's risk is?
Yeah, so that's a great question. Yeah, I was just showing you the statistics in the beginning for 15 to 19-year-olds, but everything else can apply to like a much wider age range in terms of the safety planning and other resources. There have been also increases in younger teens, and especially in those who are identifying as female, and also in young Black males, like 9 to 13. I mean, the total numbers are still very low, but like the increase in that age group is just really upsetting.
Shocking. Yeah, it is.
And the thing that differs are like the different risks. So typically depression and anxiety as being risk factors start to increase around adolescence. So around like age 12 to age like 13, 14, 15, they start to reach adult levels. But the mental health disorders younger than that are typically things like ADHD. So if a child is very impulsive, but then has some of these other things that happen, that can be like an acute event, that can be, something. Sometimes I think if someone is exposed to violence as a means of coping and that it's like normalized around them, even just, the media exposure we have with violence in the news that, you know, not in fictional, but in like in reality, you know, or just in someone's community or have. So this is why having like availability to lethal means is really important to limit, especially for children, especially those who are impulsive. Sometimes they might even be playing a game, you know, and not really thinking anything would happen. Um, so but there's definitely people doing more and more research in those areas. I think, you know, like restricting access and keeping, I know a lot of people have different reasons for having firearms available, but having them safely stored is really important when they're young kids around, especially like kids who are impulsive or having difficult situations going on.
Right. We have another question in the chat, and Miranda, that was going to be my second question, so thank you. So Anna, can you speak to difficulties that parents are having getting providers for youth who are suicidal or having mental health struggles? You know, I can speak to just in our foster care program, we've had a number of kids who are expressing suicidal ideation. We're really, you know, we're struggling to get intensive mental health services in place. We take them to WIPIC, they sit on deck all night and then get sent home, and they're sort of back to square one. Do you have suggestions for parents as far as what to do when that crisis, you know, when those providers aren't available immediately or you're on a waiting list? And any idea if that's going to ease up, or what can we do to better advocate for access?
Well, my real answer is really changes are needed on a policy level. So if things like Medicaid reimbursement increased, then there would be more financial incentive for healthcare systems to maintain access to behavioral health professionals. But there's many behavioral health professionals who can't afford providing the care because the reimbursement is so low for children's mental health. So, you know, we're, I think, all trying to stretch whatever capacity we have. At the end of the day, it's truly limited by that. We had UPMC Children's State of the Union with our president, and I mean, definitely there was a lot of conversation about enhancing behavioral health access, but it's going to be limited without some major policy changes. So I think being like advocating for those types of things as parents and as nonprofits is really important. But then, you know, different school-based services, definitely like here in our adolescent medicine clinic, we try to do integrated behavioral health. So we have social workers who will come to our visits and try to help support families to like, okay, let's try this one avenue. If that doesn't work, let's try this second avenue. Let's try this third avenue. And I know primary care providers too are trying to, you know, stay with teens until they, you know, get access to services. But we're not providing like intensive outpatient or partial or those types of things. So some of it is like sticking with families until they can get into the services that they need, but challenging for sure. But there are things, I think, the more we all know about suicide prevention and can share some of this information, the better it is, you know. So I think we can all kind of like support programs that support like school connectedness, family connectedness, those types of things that prevent these types of thoughts. Yeah.
Yeah. And do you see, can you speak to at all sort of that positive long-term, like lifelong outcome? I know that, you talked at the beginning that in some cases, suicide is not something that is curable, right? It can be almost like a chronic disease where you have those waves throughout your life. But do you have any statistics that can talk about the benefits of sort of that early intervention? Do we see adolescents by and large who are suicidal but getting help in a timely way, and have parents who are aware and intervening and getting them access to resources? What are we seeing in terms of their outcomes as adults? Is it something they're still struggling with by and large, or is it something that becomes more manageable over time? I don't know if that makes sense.
No, it does. I just can't think of like a study that's looked at that specifically. But like
Okay.
one thing to note is that teens are going through emotional brain development during that period. And there are a lot of teens who've had thoughts about suicide, but there are very few who then end up dying from suicide. So like I was talking to a researcher colleague about it, that maybe, for some youth, there can be kind of this experience of suicidal thinking that is not going to be something lifelong, but something that kind of happens during their emotional development, or they might be more at risk for. So I think that there are a lot of different trajectories that can happen for young people, and that they shouldn't have to prove themselves that they need help, because that's the difficult thing with young people, is that at one cross section, they might look exactly the same, but then one of them, when they're 30 years old, might have bipolar disorder, and the other one will have no mental health diagnosis, but you can't tell at that same cross section what will happen. So they should be able to get whatever kinds of services that they need at that time, without things getting so bad that then they're like, okay, now you deserve it.
Right.
Yeah. So I think like having these universal preventive kind of programs, there's definitely like the every spring there's the STAR conference, so the Western Psychiatric Services for Teens at Risk. That's a really great conference that talks about different interventions for suicide prevention. And one they mention is like the good behavior game, which was an intervention for kids in school. And just making like kindergarteners, like really young kids, feel really connected to each other, was like showing that there was suicide prevention as an outcome, like long term. So I think the more we can do to prevent, the better, and we don't have to prove that we're doing something, you know what I mean? Like,
Right.
yeah.
All right. Does anyone else have any questions? Okay.
I'm glad yeah, go ahead. Sorry. I just wanted to shout out, like, it's really nice. I know it's difficult to participate in research, but it's really nice to be able to share like other parents' experiences with you now that like they did participate in these interviews. So if you ever have any time or willingness to participate, hopefully it can help others.
Yeah, I think it's great. And I also wonder if seeing some of those parent comments too could be really helpful for teens to see that, how parents do react when you come forward, and that the vast majority are doing the best they can and really do want to be helpful. And sometimes they don't know how to do that, but that doesn't mean they're not willing. And to be more encouraged that they're going to have a soft landing if they turn to a parent, that's really important.
Exactly.
Yeah. Well, Anna, thank you so much. Again, this was really, really helpful, and you shared some incredible information. And thanks to everyone here who participated. We really appreciate you joining us. And thanks to NAMI again for being our sponsor. We do have another Parent Up planned. Our next one will be on May 8th. And the topic there will be, why are teens so sleepy? Why does it matter? And what can teens and their parents do to help? I feel like we maybe should have done that today on daylight savings time changing, switched it up a little bit. But if you can join us, please join us then. We will send out the slides or make the slides available when we get them. And thank you so much. Thank you, Anna, and everyone have a wonderful evening.
Thanks, you as well. Bye-bye.
Thank you.
Bye-bye.